What's going on, everybody? We are here today to talk about hamstring injuries. Kevin Durant is finally coming back tonight, so we got John here, physical therapist, with us here at Apex Performance Wellness and Rehab to break down hamstring injuries and what you can expect when you go through the rehab. Now, originally they said he'd be out for 2 games. It's been 8 weeks. We're excited to see him back in action. So, John, tell us about what we can see or experience with hamstring injuries and the different types of hamstring injuries that you could get.
Sure. So a big reason why this may have taken some time is hamstring injuries can take quite a bit of time. There's a wide variance in the research on when people can come back from hamstring back to full sport. It can be as little as a couple weeks, a week. It can be up to 2-3 months, depending on severity. So when we talk about muscle strains, there's 3 grades are typically. So grade 1 is like a real mild pull, like what people mostly think of when they pull a muscle. Grade 3 would be like a full-on, you tore it, and then you might have to have surgery to repair it. Then grade 2 is somewhere in the middle, moderate. And the more severe it is, technically the longer it's going to take for you to come back, right?
Yep.
And then, so you have, there's 3 hamstring muscles, but kind of think of them as you have your inner hamstring muscles and your outer hamstring muscles. So when you hurt it sprinting, which is the most normal way people hurt hamstrings, so they're most likely going to pull their hamstring right before their foot comes back to the ground, and you're most likely going to hurt that lateral hamstring group. Now, the higher the pull is on your hamstring, usually the more tendinous the hamstring is of that part of your muscle, and that will take longer to heal too, versus if it's a little more central or lower, it could be a little bit faster to heal. It's more and more the muscle belly. And then so when you have a hamstring pull, you go to the doctor, they might do an MRI or maybe an ultrasound. They can look at the severity of that injury.
Okay.
You can track that over time too, especially if you're in the pro sports, they're probably looking at that with imaging to kind of look at the injury and healing. So things you want to do after a hamstring injury is, one, you got to bring down pain, so you might have to moderate their activity initially a little bit. But you want to get them walking and moving to more cyclic activities as quickly as you can.
Okay.
But you also want to get the hamstring strength back. So we study hamstring strains quite a bit. We're not perfect at getting these resolved. There's a high recurrence of hamstring injuries. So why you want to be careful with them is at least 30% of people re-injure their hamstring.
Dang.
So it's high. So you want to make sure you're doing on a good rehab process to try and minimize that effect of re-injury. So we want to get your strength back, both like from a sprinting standpoint, so progressive running to sprinting program, but also like eccentric stuff, so like Romanian deadlifts, kind of like Nordic hamstrings where you're on the ground, someone holds your feet and you fall down, single leg deadlifts, lots of different bridge activities, almost like glute ham type exercises. There's a lot of exercises out there for the hamstring. Then getting into more faster hamstrings, you can even do like these tantrums where you're kicking into a band, trying to work on your ability to contract and relax your hamstring as fast as possible.
Okay.
There's a scope of exercises to progress through hamstring rehab, hopefully get the athletes back to play.
Okay. Now, I know a lot of athletes out here in Oregon have kind of been without their sport or without the ability to even train for their sport, and they're jumping back into things. So are there any predispositions or things that could make you more at risk for a hamstring injury? And are there other sports that put you more at risk for hamstring injuries?
Sure. So the biggest risk factor for hamstring injury is, have you done it before? So if you've hurt your hamstring before, you're probably at the biggest risk for one. The second thing is if you play sports at a very high speed, like sprinting, lots of acceleration, deceleration.
Wide receiver in football?
Wide receiver would be a great one, like outfielders, center fielders, to go chase after a ball. Anything like soccer is a big one too. If you're a winger and you're trying to chase down the ball. If you haven't been doing a lot of high-speed running and all of a sudden things open back up and then you're going sprinting again, you're probably at a bigger risk just because your muscles are not used to that speed of movement. So when you're full speed running, that is the highest load you can put on your hamstring of all sports. So throwing is the biggest thing you put on your arm. Sprinting is the biggest thing you put on your leg.
Okay.
So you want to be able to acclimate to that again. So progressive sprinting programs, and even being able to sprint all year round, essentially, for those type of athletes is, I think, important to try and reduce that risk of injury.
Okay. So, he's coming back tonight, ready to see him back in action. This Brooklyn team has just gotten crazy stacked, making a playoff run. It makes sense that they may have really eased him back coming off an Achilles. Are there other injuries other than having a hamstring injury to that same hamstring that could play into why a hamstring injury might come up?
Yeah, I think if you're, have some, say after an ankle injury, you lack that stiffness of hitting the ground and being strong. Okay. Maybe you're trying to use more proximally or up higher in your body, so use your hamstring. Possibly timing of your running, if you're not timing the strike of the ground, which again, your coach can help with that. As far as mechanics with sprinting, that's still kind of being researched and not a full answer on it yet. But in my mind, the more efficient you are at movement, the better athlete you're going to be. Hopefully, the less injury likely you are as well. We're still working on that from a research standpoint. Yeah, I think for a player that's on Achilles, if they don't have that ability to like strike the ground and be strong through the foot, possibly there could be some more forces transmitting up the body.
Okay.
So I could see the hesitancy there.
It definitely makes sense. One last thing. We've talked about grade 1, not as severe, but something's there. What are some feelings you could feel with a grade 1 hamstring? Like, what are the things you'd experience in your leg or in your body that would make you think, hey, this is a little more than tightness, this is actually an issue?
Yeah, so maybe like a pinching kind of sensation,
Okay.
not unless like a rip or something like that, but like
Okay.
just it feels like a pinch in there, like tightness, like you can't get rid of it, like a cramp that won't go away, possibly.
Okay.
I've seen people explain it that way, just like a feeling like you got a big knot in there that won't go away. The tightness to me, maybe it lasts longer than a couple days.
Okay.
If you just sprint it for the first time in a long time, yeah, your hamstrings are probably going to be sore for a while. That's normal after getting back into exercise. But if it's, again, you can get your quad too. People can pull their quad getting back into sprinting. Just like kind of like pinching, grabbing kind of sensation in either the hamstring or the quad. It just doesn't seem to go away as quickly as other muscle sorenesses do. So that's something to watch out for. If you're constantly feeling like one side's feeling tighter than the other, maybe something to talk to your coach or trainer about, looking at your form or kind of looking at the training you have been doing to see if you're ready for fast movements. Yeah.
Okay, now his rehab is drug on. He's going to come back into action tonight. What are some things that once the rehab is complete to getting back into sport or activity, what does that process look like? Because that's where it seems to be recurrence can happen or, issues come up. What does that portion look like? And I know, from being an NFL football player and having a hamstring issue of my own, you're taught to just go push through it. Like, is there a bone popping out? Are you bleeding? Let's push through it. But what is the fine line of pushing through it versus being actually ready to go?
Yeah, so hopefully you've had a conversation with your rehab team and your doctors to try and delineate what like your red zone is.
Okay.
So when you're training someone to get back into running, you might push through a little bit of discomfort, and you know that a mild discomfort through your training process may not be bad. You're trying to push the ability to get the hamstring stronger. But if your soreness is jumping past, moderate, maybe you want to be careful there because you might be pushing the limits of what your tissues are ready for yet. And typically, so a really good rehab program for a hamstring is going to incorporate a lot of returning to high-speed movements.
Okay.
In a stepwise manner to make sure you're tolerating those each step and you're able to do it a few times before you bump up to the next level.
Okay. You beat me to it because I was wondering, for a sport with such variability like basketball, soccer, football, you can't really get the movements and motions. You can only simulate so much in a rehab environment. What are some things you might do with people in a rehab environment to help get them ready for that variability?
Well, that's exactly. So after you've done, like, say with agility exercises, things you know that are coming. So say I'm going to go to this cone, I'm going to go to that cone. I have to go, the ball's over there, I'm going to chase it. Then you have to add in randomness to get more towards what a real sport is, or have them do some kind of like mental task while they're moving to make it more like a reactionary thing that's going to happen in sport. So if you're a cornerback and you're backpedaling, like you know the couple routes that a receiver is going to do, but you're still reacting to them.
Exactly.
So if you've been doing just planned, okay, I'm going to go cover a slant. Okay, now I'm going to go cover a corner. Then you got to come in with a random. You point somewhere. Like everything has to come be reactionary to try and get an athlete back to that movement. All
right. Well, we're all excited to see him back in action. It's always fun to see one of the top players return to what they do and what they do best. We're excited to see it. If there's anything going on with your hamstrings, just let us know. We're always here to help you, whether it's a virtual visit or coming on in here in person. We love to help take people from, not feeling so great and getting them back in action. So we'll see you soon on the next video. Stay tuned for more.